بسم الله الرحمن الرحيم. Dear students, with you Dr. Fatma, lecturers of psychiatry, neuropsychiatry department, faculty of medicine, Tanta University. Our topic today is about treatment of psychiatric disorder. Goals of treatment in psychiatric disorder. Number 1, relief of symptom like other branches of medicine, but we add here in our branch psychological and social adaptation. That is because psychiatric disorder can passively affect social and occupational career of the patient. Also, we add prevention of relapse because psychiatric disorder can be relapsing and chronic. Treatment modalities. Treatment on psychiatry may be psychotherapy, somatic therapy. Somatic therapy include pharmacotherapy or drug therapy, electroconvulsive therapy ECT, or psychosurgery, which rarely be done. Psychotherapy or talk therapy, treating patient utilizing psychological theory. Examples: psychoanalytic psychotherapy, supportive psychotherapy, behavior therapy, cognitive therapy, and group therapy. Number 1, psychoanalytic psychotherapy. Help the patient to develop insight into unconscious conflict. Number 2, supportive psychotherapy. The goal is to strengthen defensive mechanism to assist day-to-day functioning. Number 3, behavior therapy involves modification of the behavior of the patient which precipitate emotional distress. It is used to change maladaptive behavior. For example, phobias, compulsions, overeating, cigarette smoking, stuttering, and sexual dysfunction. It includes reward and punishment, aversion therapy, flooding, exposure and response prevention. Number 4, cognitive therapy, aiming at correction of cognitive distortion or errors in thinking and in depression. Number 5, group therapy, aiding in drug addiction. Pharmacotherapy or drug therapy. Pharmacotherapy or drug therapy in psychiatry, it is very easy because the treatment when you want to treat depression, you can give antidepressant. Drug therapy for psychosis is antipsychotic. Drug therapy for anxiety is anti-anxiety drugs or anxiolytic. Drug therapy for mood disorder, anti-manic or mood stabilizing drug. Number 1, anxiolytic drug. Anxiolytic drug include benzodiazepine, non-benzodiazepine, and SSRIs. Number 1, benzodiazepine drugs. Examples: diazepam, alprazolam, clonazepam. Therapeutic effects: sedating, anxiolytic, used in anxiety, panic, and insomnia. May be used as an anticonvulsant, may be used as muscle relaxant. Side effects: precaution must be taken when prescribing this medication, benzodiazepine, because it can cause habituation and dependence, daytime sleepiness, impaired concentration, and mild forgetfulness and memory impairment, and accident and falls and depression and agitation. When we prescribe benzodiazepine for a patient, we must do it for a short time with precaution that the patient, as we can, use the drug at night at bedtime, not when he go to work. When he want to go to work, not take this drug. When you are working in front of a machine, when you are working in a dangerous place, don't take this drug. Non-benzodiazepine, buspirone, slower onset of action, less potent and lower risk of abuse or functional impairment than benzodiazepine group. Number 3, selective serotonin reuptake inhibitor, SSRI, as fluoxetine and paroxetine. Antipsychotic. Antipsychotic drugs including conventional antipsychotic and atypical antipsychotic. Conventional antipsychotic, for example, chlorpromazine and haloperidol. It acts through blocking of dopamine D2 receptor. Atypical antipsychotic, for example, risperidone and olanzapine. It acts through blocking dopamine D2 receptor and serotonin receptor. Atypical antipsychotic have less experimental side effects of conventional one. For example, dystonia, tremors, and tardive dyskinesia, but have the hazard of metabolic disturbance. Both can cause weight gain and endocrinal disturbance. Antidepressant. Antidepressant drug include tricyclic antidepressant, tetracyclic antidepressant, selective serotonin reuptake inhibitor SSRI, fluoxetine, sertraline, citalopram, paroxetine, fluvoxamine, SNRI, selective serotonin and norepinephrine reuptake inhibitor venlafaxine. Adverse effects of antidepressant drugs: anticholinergic side effects, more with tricyclic, dry mouth, constipation, loss of visual accommodation, urinary retention, precipitation of narrow angle glaucoma, confusion, disorientation, delirium, sedation, fatigue, switch of bipolar disorder from depression to mania, decreased libido, erectile and ejaculation dysfunction, and this occur more with SSRI. Cardiac side effects are more with tricyclic antidepressant, the less with SSRI. Mood stabilizer, lithium, carbamazepine, valproate. They are used to control manic episode and also for relapse prevention. Mood stabilizer can include also atypical antipsychotic like olanzapine. Electroconvulsive therapy, ECT. ECT is the treatment of choice for the patient who are so acutely dangerous or suicidal that a course of pharmacotherapy might be too slow to help the patient. Indications of ECT: major depressive disorder, any type, bipolar disorder if in depressive episode, bipolar disorder if in manic episode, when only after a medication failure or if patient is acutely dangerous. Schizophrenia when non-chronic, when acute, especially paranoid catatonic type or with prominent affective symptom. Pregnancy with the drug. Pregnant women when the drug are contraindicated for the mother or a baby. ECT often is the treatment of a choice in suicidal depressed patient or psychotic pregnant patient who should not receive psychotropic medication. ECT is usually given 2 to 3 times a week. Depressed patients usually require 6 to 10 treatments. Schizophrenic patients usually require 10 to 20 treatment. It should be followed by other treatment, for example medication or psychotherapy, after a course of ECT has been completed. Side effects of ECT: transient memory impairment, retrograde and anterograde amnesia may occur following the course of ECT, usually resolve 1 or 2 weeks after the course of ECT. Post-ECT headache might occur, but it is controllable. Contraindications of ECT. Relative contraindications: fever, significant arrhythmia, extreme hypertension, coronary ischemia, recent myocardial infarction, increased intracranial pressure, including cases of subarachnoid hemorrhage and intracerebral hematoma. Absolute contraindication. There is no absolute contraindication for ECT. Thanks.